Important to consider the context of New York City. It's thought of as a highly connected, metropolis, leader of the world. But at the same time, access to care is challenging, right? Even with those innovations, the money and everything that comes with it. What that means is we have 30% of our population in New York City without broadband access or access to a smartphone, which sometimes makes it difficult, right? We have the working class in New York City that might have to travel 30, 40, 50 minutes to get their care. And they might have to take time off from their jobs, right? Which isn't necessarily there to give that time off. They can't afford to take that time off because people might have multiple jobs. So the combination of those things make it difficult sometimes for patients to access care. And so when we started Virtual ExpressCare as our telehealth platform for on-demand care, we really meant that. We wanted to give a patient immediate access to a clinician in order to get an assessment. And that allows the patient to do so from the comfort of their home or another location, right? It could be the public library, for example, or it could be a homeless shelter, or it could be some other location that we set up in partnership. And it allows the patients to get that care on their own terms in a private location that they feel comfortable in and not delay their care. We started with our medical care. We call it urgent care, but it's really accessible for medical care. It's emergency medicine trained physician, typically, connected within 4 minutes to a patient, and the patient gets an assessment. And then we kind of figure out what needs to happen after that. Is it testing? Do they need to get connected to long-term care within our system or other systems? Do they need an emergency transport to the ED because it's an emergency situation? We kind of figured that out, work with the patient, and make that happen. We expanded that to behavioral health. We have a 24/7, 365 access to behavioral health care that is psychiatrists, social workers, clinical social workers, addiction counselors, as well as support staff that is there to help patient with brief intervention. Once again, an assessment with the clinician, stabilize the patient, and figure out what the next step is. And that includes, substance use treatment. So we provide Suboxone and buprenorphine for our patients. So we're able to really meet the needs of the patient and access in a moment that they feel ready. Lastly, I think I'll talk about reproductive health. It's something we started last year. Really think about sexual health as well as reproductive health and making it more accessible, right? In the post-Roe world, there are some access challenges, particularly for those that might come from underserved neighborhoods. And there's an equitable piece that we wanted to address by giving that access to individuals. So telehealth, once again, is our implementation. Our patients come in all throughout the city. They're able to access the care. They get a full assessment. They make a decision, and we will mail that medication kit to the patient's home, and it will get there the next day or the day after, within 48 hours. All of those come together to really think about how do we interact with that patient? How do we get them to be engaged with our providers? And how do they do it in a manner where we don't take too much out of their busy lives?